Welcome to the Green Nurse Podcast. This is our Wednesday clinical conversations with the green nurses at Holistic Caring, where we bring hope and inspiration for growth and healing. And we are truly here to change the dialogue and stigma around what it means to feel good and be high. And you'll hear me say it once, you'll hear me say it twice, and you'll hear me say it every day. We all deserve to feel good. So I want you to think of the word high as H for hope, I for inspiration, G for growth, and H for healing. And here's what we're doing in the space as cannabis nurses. And we're really excited to have you come along with us to help us change the paradigm.
Change the paradigm of healthcare.
We can't hear it. Well, I'm going to remove that because you guys can't hear it. If you can hear us, can you please just give us a shout that you can hear us? Can you hear us? Can you hear us?
This is in Facebook.
Yeah.
Threads. Okay.
All right, we're going to get started. I'm really hoping you can hear us. So I'm going to get started with the show real quick here. Elizabeth and I have been presenting all month long at various places. I want to introduce my co-host, business partner, and partner in life, Elizabeth Mack.
Thank you.
And we're here to present the Los Angeles Association of Healthcare Underwriters presentation that Elizabeth has presented to LAAHU. And I put a link into the comments so you can all see where we presented.
See where LAAHU is. And so we've been out writing presentations to influence, educate, inspire, and inform, and get people to understand what we do and what we know all day in helping people use these plant medicines. So speaking to the Los Angeles Association of Health Underwriters was wonderful because we got to educate about 100 insurance brokers that day on how we're going to work with them to bring their clients and patients better options and different options, complementary options.
Excellent. So I'm going to pull up the presentation now, since the little video that we love to show at the beginning of the podcast isn't displaying any sound. So here we go. I'm going to pull up the slides for today. And here we go. Improving health outcomes with CBD, how to approach high-cost disease management with lifestyle and CBD. So ABCs of CBD with energized living modalities. So Elizabeth's going to start the presentation. I'm going to pick up and she's going to close out. Here we go.
Here we go. All right. So, yeah, thank you, Sherry. So our learning objectives today are really to discuss the U.S. healthcare system and the imperfections of it. Identify better health potential outside of the healthcare matrix and what that is. Approaching high-cost disease management with lifestyle and CBD. Understanding how the endocannabinoid system regulates health. Combining CBD and health promotional activities for cost-effective outcomes. And to review the potential health savings with CBD as medicine. So how can we help more people? How can we bring this to more people? And that's what we're doing today.
Absolutely.
So to start with, we like to talk, nurses always do an assessment, right? How are we doing in global healthcare measurements? How are we feeling as a country? Well, one of the first questions are we getting what we pay for, right? The U.S., our United States, is spending the most on healthcare and having the worst on outcomes for developed countries. So if you think about the 50 top countries in this world, how much they're spending and what they're getting. So next slide, we'll talk about a little bit of what we get. The U.S., as you can see top line here, we are spending more than any other developed nation on earth, about $13,000 per member per year, per United States citizen, in fact. And that is going to employer premiums to pay for our healthcare coverage, as well as direct care costs. And when you average that out for a lot of people, it comes to about $4.5 trillion that we're spending. If you look at the right, you see the graph. We are placing last in outcomes on infant mortality, folks living with chronic disease, and lifestyle, life expectancy. So we are dying faster. We're not making it. And those of us that are living are spending more and more years with poor health. So what does that look like? Americans live shorter, less healthy lives because our system's not working well. We're discouraged from using healthcare services, and affordability remains our number one issue why Americans don't get coverage and skip and delay needed care. So we don't do primary prevention like other nations. Our public health system is fractured, and we underinvest compared to other industrialized nations on societal things. We spend our money on sick care, and they provide universal coverage and upfront support for their citizens. And this was reported in CNN by Munir Agunya for the Commonwealth Fund. Next. And, why we're failing really goes back to what is the cause? We talk about the problem, but how do we unearth what the cause of this problem is? Well, it really does go back to big pharma. Think about back in 1980, we had a recession. We were living with all kinds of things that were going on and on high inflation, and the government cut back. So they stopped funding. They didn't stop funding the NIH, but the research and the R&D for pharmaceutical companies really began in the labs at that point, when we started funding the universities and then changed the patent process so it didn't have to be a government anymore. It could be private industry. And now that's how we got the big pharma influence with all of the R&D at the universities. And so now we've got 96% of all of our biomed research being done to increase novelty, speed, and profits for drug companies, as opposed to improving population health, which is only getting about 4% of our R&D efforts. And then the clinical trials data is now owned by big pharma, and they pull out the marketing data that they want. They extract the studies that showed that it wasn't working all that well, and we're getting these medicines that are approved that shouldn't necessarily be approved. And to prove that point, Trulicity is a type 2 diabetes drug, and it can lower blood sugars, but they also said that it can help reduce weight. And then they figured out that it might be able to reduce heart attacks and cardiovascular illness. And the number needed to treat was an astounding 327 patients needed to take this drug at 3 years, for 3 years, at a cost of $2.7 million to taxpayers to fund this research to prevent one non-fatal heart attack. So now we can see why it's crazy. And then this drug costs $818 per month. You get an injection every week. And that's what people are doing now. And here's the other thing that Big Pharma did. Took away the responsibility. If I don't have to manage my weight and my type 2 diabetes, and I can take an injection once a week, why not? Keep going. Because the secret to great health is escaping the matrix, right? What is the healthcare matrix? Think about our conventional care system, the cradle of the hospitals, the medical groups, all of the imaging, diagnostics, pills, and procedures, right? And the suffering that we endure. By the way, this is a McKinsey study. You can go online. Just came out in December of last year. And what McKinsey studied in their health policy is that the suffering that we endure to achieve longevity is unacceptable and it's unnecessary. Then our mental, social, and spiritual health are as important as our physical health, and all three are deeply interconnected. Health is mostly about our ability to function, not just absence of disease or death. And health exists on a spectrum. So optimal health needs to be defined, measured, and chosen. And we have agency to choose that. And finally, most drivers of health sit outside the conventional care systems and are modifiable. So what does that mean? Well, when we look at the sorry status of global health, 2/3 of us have cognitive impairment by the age of 70. 69% will spend 3 years in long-term care settings. 2 billion people experience chronic pain. 300 million people are incontinent. 33% of men and 45% of women experience sexual dysfunction. 548 million people on Earth experience anxiety and depression. 33% worldwide feel lonely. And healthcare bills are the leading cause of U.S. bankruptcy. So if we look at all of the years we're spending and increased life expectancy, the problem is we're spending more years in the red, not doing too well. So what does it mean to really be well? Health is about these things. So continuing on the McKinsey health policy study, The physical, the mental, the social, and the spiritual all deeply interconnected, and this is what's working. So our vitality, our energy, our concentration, our cognitive abilities, our relationships, and how we show up in this world, and our spiritual sense of purpose and what we're clinging to and striving to be better people connected with God and each other. So next, what matters is lifestyle, right? So if most drivers of health sit outside the conventional care systems and are modifiable by us, how do we better value our health? That's the question for all of us. It's not about our seatbelts, vaccines, prescription costs, and cancer screenings. It's about what we put into our bodies, what we expose our minds to, how we spend our time, how we move, and our beliefs. So everything we do or don't do affects our physical, our mental, our spiritual, and our relational health. And when we take responsibility for this, now we have agency. It's not easy to take responsibility because then you have to do something. But once you have that, now you can do something, and we are all capable of change. So breaking resistance to self-care strategies is really where we have to start. Why do people not take better care of themselves? We think self-care is selfish, or that strong people don't need it. We think we haven't earned it, or we don't have time for it. An external locus of control. We don't see ourselves as charged. Somebody else is going to take care of this for me. And discipline and abstaining are needed. We just want to feel good now. So it's that take a pill and forget it. No, you have to do something to take care of yourself. So here's what we do about it. We acknowledge that these thoughts are in our mind, but realize they're conditioned thoughts. Somebody taught us. And going back to that chosen health, we can become the gatekeeper for a precious child. So imagine you have a beautiful child you're taking care of. You want to keep in the good friends, nutritional food, peaceful sleep, healthy activities, enriching learning, appropriate challenge, love, and support. You keep out the manipulative people, drugs, alcohol, tobacco, and mindless TV. Now realize that you are that precious child and you are in control of your best self. And when we feel that, now we can start to share it. We live it, we embody it, we take care of ourselves, and then we start to train others. So I spent 20 years at insurance companies and did a lot in workplace wellness as the sales manager for Anthem Blue Cross for the County of San Diego. And we talked about workplace wellness programs all the time. So when we roll this out in an employer, we have lifestyle assistance, which gets about 87% of the enrollment, and then disease management, that gets about 13%. Well, it turns out that the disease management section maintains about 87% of the healthcare cost savings, generating about 136 per member per month in savings, along with 30% fewer admissions. So disease management makes a big difference. Then think about CBD. We're going to explain what CBD is, but if CBD was added to this disease management, we can improve these numbers because we're going to couple that with nurse coaching, and the nurse coaching helps us with the physical, mental, emotional, social, and spiritual connections. And when we pair that with CBD, we can now take the advantage of the CBD to decrease inflammation, decrease anxiety, decrease pain, get people moving and focused and energized again, and then they're going to live a better life. So that brings a return on investment. Everybody knows ROI is that return that we're hoping to save employers money. Think about the employers. We're trying to create jobs. If you're spending all your money on health insurance premiums, how are you reinvesting in your business? If your employees are out sick all the time, how are you growing? That's why we need to fix this problem at the root cause. And healthy living plus CBD can bring savings. In fact, when we do some of these lifestyle interventions, we can save $14.21 per participant, $6 in savings for every dollar invested. And an example of that was done by our friend and colleague, Dr. Philip Blair. He is working with us now to pursue these strategies with more self-funded employers and other health plans that want to put their hand up and say, I'm looking for options on how to save money and improve care. Who can do that? That is the golden grail in healthcare. So what he did was take 36 members of this plan and identified the high costs. Who are the frequent flyers in the health system? And we pull those out. We get them CBD. We give them nurse coaching. Over a year, we were able to find 30 positive clinical events in this case study. 8 of them were able to decrease biologics. And if we look at the cost of these biologics, divide 300,000 by 8, that's quite a bit. And so if we're saving just on that with the drugs and then the inpatient hospitalizations, the procedures, and the other pharmaceuticals that were decreased, we're saving $538,000 for this one employer on 36 lives. So imagine what we can do if we could take this into greater healthcare coverage. So, okay, cool beans. Show me the CBD. With that, I'm going to introduce back to Sherry to take us forward on how we're going to talk to people about CBD and educate them on what we know.
All right. CBD, cannabidiol. People will ask, Sherry, what's CBD? I said, well, it's cannabidiol, and it is a cannabinoid that is found in the cannabis plant. And it is absolutely an amazing molecule. We're going to dig into it in a minute. But first, I want to give a tribute to Dr. Raphael Mechoulam, who died this year. He has been stated that cannabinoids hold the potential to modulate all human diseases. He's the father of cannabinoid medicine, Israeli researcher and scientist. In 1964, he isolated the THC molecule. I like to call it the total healthcare molecule. And he's published over 350 studies. So here we have a timeline of cannabis medicine in America. And you can see all of these different bullet points with these different dates, but I'm going to try to bottom line it here. You know, when I'm working with patients, specifically those that are a little bit older, you know, they don't understand, they don't understand prohibition. They don't understand Schedule 1, and they don't understand why this medicine has been prohibited for such a long time. Because now, as we educate them, they're understand the science and the research, and that we have an endocannabinoid system. So in 1854, cannabis entered into the U.S. dispensatory. So it was actually in the pharmacopoeia. Doctors approved of it, nurses approved of it. And in 1920, cannabis extracts were sold by pharmaceutical companies, Merck, Bristol Myers, Squibb, and Park Davis.
Big ones.
Big ones. And one of my nursing colleague friends of mine, whose father was a pharmacist, and he actually sold cannabis formulations in his pharmacy back in the 1920s, 1930s. So here we go, in 1937, the Marijuana Tax Act, right? It was literally, I'm going to name 5 different industries that it was prohibited by. Think about the food industry, the paper industry, the alcohol industry, the tobacco industry, and the pharmaceutical industry. Because cannabinoids can be used for what? Fiber, food, fuel, textiles, medicine, clothing. Okay, so basically this is to protect corporate profit. So they decided to start the Reefer Madness campaign, which was completely racially motivated. Over time, 1941, cannabinoids removed from the pharmacopoeia. The American Medical Association actually opposed, claiming that there was therapeutic use. But however, cannabis did survive in Northern California. And then we go into the 1970s, Richard Nixon, he passed the Controlled Substance Act, which was also politically, racially, and actually industry driven to protect corporate products. And they put cannabis in the classification of Schedule 1, along with heroin, LSD, PCP, and Schedule 1. No medical benefits, and highly addictive and abusive, which we all know isn't true. In 1996, California passed Proposition 215 for legal cannabis. Can you make sure that this is plugged in? This isn't plugged in. Sorry, we're losing our plug. It's got to be plugged in. Okay, there we go. In 1996, California passed Proposition 215, legalizing cannabis. And so currently right now in 2023, we have 38 medical states and 22 adult states. So the cannabis plant has been around for over 5,000 years. It's been used in humans for medicine, for entheogenic principles. There are so many different compounds in the plant, including cannabinoids, terpenes, flavonoids, biologically active compounds. The medicine is found in the trichomes, and it's actually influenced by the strain, or the chemovar is influenced by where it grows, the soil, the climate, the sunshine, the water, the cultivation. And what is so amazing about this is that it is a pleiotropic, meaning that it affects many different physiological systems all at the same time. So phytocannabinoids activate the endocannabinoid system, and they mimic the endocannabinoids that we make. And this is why we're going to get into CBD. So a little bit more of the endocannabinoid system, just so it kind of makes some sense. So when we're teaching patients and even clinicians, we want them to understand that the endocannabinoid system is the conductor. It is the master regulatory system of the body. It regulates all 11 organ systems, our immune system, and all the neurotransmitter signaling systems. And I know you've all heard of dopamine signaling, serotonin signaling, opioid signaling. And so it acts like a switchboard or a feedback loop, correcting cell signaling to restore balance. So I want you to imagine the umbrella as your body, because the spokes of the umbrella show the interconnectedness of all of the systems. And you think of the neurotransmitter messaging signaling systems, they give messages to the different areas of your body to either do something or stop doing something. So the endocannabinoid system reacts to stress or changes, triggering a release of endocannabinoids that we make, and it turns up and down cell signaling between the cells to provide what? Homeostasis or balance among all body systems. So it's a conductor regulating both the fight or flight response as well as the relaxation response. And the body functions optimally when it is in the relaxation response. Then we teach a little bit more about the endocannabinoid dome, which is the larger environment that interacts with the endocannabinoid system. And so when we're looking at this dome, it really looks at all of the different components of mind-body health, of total healthcare THC. So we look at food and nutrition and supplements. We look at the microbiome, we look at the lipid dome, and we look at mind-body techniques, as well as cannabis constituents and cannabinoids as to what we put into our body. All right. And this is just another example as well, which I really love. Vincent DiMarzo said, eat, sleep, relax, forget, protect. So healthy endocannabinoid system is healthy endocannabinoid tone. A diseased endocannabinoid system or endocannabinoid deficiency means that we're predispositioned to disease. So I want you to look at this cool little slide here. So normal neurotransmitters flow one way. They go from the presynaptic neuron to the postsynaptic neuron. One-way signaling. Well, the endocannabinoid system, being the largest neuroregulatory system in our body, communicates two ways. So basically, it goes from postsynaptic neuron to the presynaptic neuron. So it means that our body, our smart body, activates the endocannabinoid system. We release these endocannabinoids to go and nudge this cell, to plug in, to nudge, to give a message, to do something or not do something. Very, very interesting. Two-way communication street. And then this here just goes to show all of the different systems. Again, if you go back to the umbrella concept, you can see how the endocannabinoid system and the body systems all play a role together. So it's responsible for motivation and reward. And so what is that? The dopamine, right? Thermoregulation, trip receptors, stress response, cortisol, metabolism, appetite, mood, pain, energy, sensation, inflammation, muscle control, and intraocular pressure. So you can see, if you go back to the little umbrella here, right, the interconnectedness of all of our systems. So what happens is when the body is triggered, right, what happens is the endocannabinoid system switches on, releases these endocannabinoids that we make, showers on our umbrella to give messages to tell our body to do something. So what happens, right? So here we go. Feedback, right? Feedback loop. So what happens when we don't make enough of our own, right? So the endocannabinoid system is how cannabis works in our body. It is the maestro to the symphony that is every physiological system in the human body. And its role is to keep us healthy. So if we're not producing enough of our own endocannabinoids, what happens? We may have an overexpression of CB1 and CB2 receptors that are actually looking for those endocannabinoids that we make. And so you can see all of these different diseases and conditions that exist down here that have been researched and substantiated to be an endocannabinoid deficiency. Endocannabinoid deficiency and repair. So when I'm lecturing and teaching, a lot of times clinicians and patients will raise their hand and they'll say, gosh, Sherry, I love it that I'm making molecules in my body like the plant. Well, if I make molecules in my body like the plant, then why do I need the plant? Well, my simple answer is if your umbrella isn't going down, up and down nicely, if you're on pharmaceuticals and you're not functioning or living your best life, you may just need the plant. So causes of an endocannabinoid deficiency are age. And generally, as we age, our endocannabinoids that we make, the anandamide and 2-AG, start to be depleted. Genetics plays a huge part in it. Poor diet's probably the number one. And if you go back to the lipid dome and the microbiome and nutrition and supplements, we look at all of that. fast food, fried food, fake food, artificial flavors, artificial coloring, trans fat, hydrogenated oils, high fructose corn syrup, sugar, right? All of these things are not healthy for our system, and we know that. Lack of exercise, obesity, chronic stress, poor sleep, chronic alcohol use, smoking cigarettes, polypharmacy, right? If you're on 5 or more pharmaceuticals, there's a 50% chance that they're interacting with one another. If you are on 10 or more, it is a 100% chance that they're interacting. And the most important thing to understand about polypharmacy is drug muggers, right? Where certain pharmaceuticals actually steal nutrients from your body, or you don't absorb them, or you don't know how to utilize them in a proper way. So it's very, very important for people to supplement if you're taking pharmaceuticals, to look up and to know. And there's a book called Drug Muggers that I encourage. Diminished social interactions, lack of touch and laughter. So you can see there is a whole host of reasons why our endocannabinoid system may not be functioning optimally. So how do we support it? Only look at the other side of the map, right? Food is medicine, whole foods, adaptogens, supplements, herbs, regular exercise. Motion is the lotion. When you exercise, you release these endocannabinoids. Meditation and breath work. Meditation has been shown to increase our endocannabinoids, anandamide, by 168%. That's huge. Mind-body medicine, massage, therapeutic touch, energy work, acupuncture, chiropractic care, limiting alcohol, restorative sleep, social connections, laughter, and play. And you can see at the very end, I have cannabis and hemp. So, a lot of times when we're talking about cannabis as medicine, cannabinoid therapeutics is much more than just cannabis because of that endocannabinoid dome and how the system works. But oftentimes when patients come to us, they have exhausted this list. Many patients are doing the best they can with what they have, and they've tried all of these, and they'll say, God, it doesn't work. None of this works for me. So once we introduce and supplement with cannabinoids, all of these different things start to work a little bit better, and people start to see the results that they're looking for. Here we go. This was a big shoe drop for me. When I first started studying cannabis as medicine, when I heard that we made a molecule in our body like THC, I was kind of floored. I was like, no, really? Well, anyways, THC mimics the anandamide molecule that we make. And you can see here in the diagram that the molecular shape is very similar. It plugs in to the nerve cell and gives a message. So the plant makes THC, we make anandamide. The molecular structure is very similar. The difference is one comes from a plant and one we make. So cannabinoids are molecules that interact with the endocannabinoid system. Endocannabinoids we make, the anandamide and the 2-AG. Phytocannabinoids the plant makes. That's the CBD, the THC, and all of the other minor cannabinoids. And then the synthetic cannabinoids the pharmaceutical companies make. So in 1964, Raphael Mechoulam isolated THC and CBD, the phytocannabinoids. And then as they were continuing to do their research, they were like, how is this working in the body? Why is it working on so many different systems? So in 1988, they did a study. They injected synthetic THC into someone's body, and they did radiographic imaging, and they saw that we lit up like a Christmas tree because we have CB1 and CB2 receptors on all of the cell surfaces of all of our organ systems, right? We have more CB1 and CB2 receptors in our body than any other receptor. And what that does, again, is to provide the correct signaling between the cells. So when I've spoken about this in the last slide, so endocannabinoid receptors, CB1 and CB2, are upregulated in sick cells, meaning that they produce more. Our body produces more, actually seeking that anandamide and the 2-AG to restore cell signaling and balance. 1992, that is when they discovered the endocannabinoids that we make. So the difference is between anandamide and anandamide and the THC molecule that is really important that I like people to understand is the anandamide molecule is 1/10 the strength of the THC molecule. The THC molecule is very, very strong. So when anandamide gets released, it nudges our cell. It doesn't lock in and hang in there. It nudges. So we produce them upon demand. We degrade them when they're not needed, and it nudges. THC is much stronger. So this is when we educate with patients, you don't need a lot of THC to start. We want to wake up the system. And we'll talk about this in the next couple slides. So there's over 140 phytocannabinoids, only few are available. They all activate the body's self-healing abilities over time. THC binds directly to the CB1 and CB2 receptors. Large doses may cause euphoria. We definitely teach microdosing because we want people to feel good. The goal of taking cannabis as medicine is to take the least amount to get the most functioning below the threshold of being impaired. CBD, we're going to get more into CBD, works on over 70 receptors in the body. It inhibits the FAAH enzyme. Remember how I said we create endocannabinoids and we degrade them? So if you're taking CBD, what it can do is inhibit the enzyme that breaks down your own anandamide molecule, keeping that molecule circulating in your body a little bit longer, keeping your own anandamide plugging in or nudging those different cells for cell signaling correction. Also acts as an antioxidant protecting cells and also a neuroprotectant. Then you have all of the other minor cannabinoids, THCA, CBGA, CBDA, which are the acidics found in the raw plant, CBG, CBN, THCV, delta-8, THC. So when we talk about the plant, we talk about each of these individual cannabinoids, right, are soloists, okay? Mm-hmm. Just imagine we got the violin as CBC, the drums as CBD, CBDA might be the flute, right? So all of these play an important role in our body, but if you imagine you put them all together, here you have the orchestra where you harmonize and synergize, and that is what we call the entourage effect. The entourage effect states that the whole of the plant is greater than its individual parts. So that is why we educate on using whole plant formulations to get the most bang for your buck. All right, CBD as a supplement. Absolutely. CBD, like we had said before, is a cannabinoid. Cannabinoids are found, phytocannabinoid, it's found in the cannabis plant. So one of the things when I'm teaching and educating, I'll ask the audience, do you know what the difference is between cannabis and hemp? A lab result. That's it. The cannabis plant has over 0.3% THC and the hemp plant has less than 0.3% THC. So when we're looking for specific medicines, we are looking for flowering strains of hemp, flowering the cannabis plants where all the medicine is rich in those trichomes. So there's many different product types, but there's 3 different types of CBD that we see in these products. We see isolate CBD isolate, which is the single isolated molecule, which is the soloist, right? We see broad spectrum CBD, which is whole plant, where they've extracted the THC. That's a little bit better. The orchestra is starting to fill up. And then full spectrum CBD is whole plant medicine with less than 0.3 THC. That is where the entourage effect is happening. The symphony. THC is the maestro that is leading all the rest of the cannabinoids. So cannabinoids is antioxidants and neuroprotectants. So when we've been educating, we always like people to understand that the government has a patent on this 20 years ago, 2003. You know, cannabinoids are found to protect cells from damage, decay following ischemic insults such as stroke and trauma. Cannabinoids may treat neurodegenerative diseases such as Parkinson's, Alzheimer's, and dementia. This is really important.
20 years.
Okay. 6630507. I have a song. 6630507. And here we go. We have the power couple, right? You need them both. Go back to the symphony. We have isolated molecules. You just imagine, go back to the umbrella concept. If we're just taking THC molecule only, it's going to poke, right? It's going to go around a single isolated molecule compared to the entire symphony, the whole plant showering on our umbrella. So we talk about the power couple of THC and CBD. You need them both. THC activates the CB1 and CB2 receptors. CBD activates over 70 targets in our body. And the reason we like them both together is because CBD modulates and can soften THC without taking away the medicinal effect. So THC makes CBD effective, and we look at CBD and THC ratios for maximum gains and to minimize the side effects. And just an example is a 20-to-1, 20 part CBD to 1 part THC. We see a lot of great results when people are starting cannabis as medicine. So just imagine if you're eating well, if you're sleeping well, you're able to get into the relaxation response, Forget your troubles, come on, get happy, right? And protecting your body. You have a functioning endocannabinoid system, hopefully, right? And if you're not, you need to call us. Cannabis is medicine. It is as an analgesic, and this is the combination of the whole plant. Acts as an anti-inflammatory, anti-anxiety agent, anti-nausea, anti-cancer, anti-convulsant, antibacterial, antipsychotic, primarily CBD, antispasmodic, a bone stimulant, immunomodulatory, dialing up, dialing down the immune system, neuroprotectant, and neurogenesis, helping to create new nerve cells to improve cellular communication. This is amazing. This is my favorite, the medicinal treasure trove, observational and preclinical data. So I want you to look at this. Go back to the umbrella, go back to all of the organ systems, right? Neurological, our nervous system. It levels out GABA and glutamate, right? These neurotransmitters that are in our brain, it's a fine balance between them. We need to have GABA, we need to have glutamate, but when we have too much glutamate causing that exocyticity, you're promoting inflammation, right? And neuroinflammation. In psychiatry, more so along the mental health and wellness, anxiety, depression, insomnia, PTSD, helps with neurogenesis, neuroprotectant, improving neuroplasticity so our brain can communicate. Helps with autoimmune conditions, stabilizing the body, decreasing inflammation, improving metabolism. Cancer, anti-neogenesis, anti-proliferative, apoptosis, reducing nausea from chemo and radiation treatments, decreasing pain, and lessening anxiety. And then in Alzheimer's, we've seen it, decreasing the amyloid plaques and the tau tangles, improving nutrient delivery to brain cells, right? Slowing the progression, helping with palliative care, improving decreasing the breakdown of acetylcholine, which improves memories. And then Parkinson's, reducing tremors, decreasing rigidity, improving mood and sleep. And then MS, chronic pain and addiction. So we can see what it does, reducing spasticity, nociceptive signaling, turning down that pain response, helping boost the efficacy of other pharmaceuticals, and then people that have addiction. So a lot of people that come in that are working, that have addicted to other substances, what we actually see is a harm reduction tool. CBD actually balances all of those organ systems have been affected by addiction and reduces cravings for drugs and alcohol. Very, very powerful plant. And here's a case study. A woman that we've taken care of that has been struggling for over 25 years. This is just a demonstration of the pleiotropic nature of utilizing cannabinoids as medicine. So she had chronic pain. She was on multiple pharmaceuticals. She had inflammation, gastrointestinal disturbances, emotional issues, energy imbalances, sleep disturbances, and she also had issues of menopause. And so what was added was CBD capsules, 50 milligrams of CBD twice a day, a 1-to-1 CBD to THC tincture, a little inhalation in between, and topicals. And what happened over time is her symptoms started to decrease and she started functioning again. And so you can see how in chronic pain, CB1 turns down the pain signaling, CB2 receptors quiets the inflammation, and CB2 activation, I can't say enough about, really, really helps not only pain and inflammation, the inflammatory response, but also helps with brain health. Polypharmacy, this woman was able to wean off a lot of her steroids and she was able to cut her opioid use in half. And then the inflammation, adding these other minor cannabinoids actually helped all act as anti-inflammatory. GI imbalances, the endocannabinoid system works on our gastrointestinal symptoms. So THC actually soothes GI pain, helps decrease diarrhea. CBD and CBG can calm the gut, may help repair lesions. And CBDA lessens anxiety and calms the microbiome. Emotional issues. So CBD activates the 5-HT as an anti-anxiety and an antidepressant. CBD actually works on the hippocampus for neurogenesis to help improve memories. And then energy imbalance. We can see that's combination of CBG, CBD, and specific terpenes such as alpha-pinene and humulene can promote some energy. And sleep disturbances. So a combination of THC, CBD, and CBN together may be sedating and may help in a restful slumber. Menopause, 36 symptoms of menopause. I think she had them all. And literally, it softened her menopause systems. reducing hot flashes, and improving sexual dysfunction. So this is huge. And we see patients with this all the time. So when you're looking at chronic illness, it's just not one body part, it's multiple. Chronic illness affects mind, body, and spirit. And when you think of all the organ systems that we have, it affects them all. So what do we need to do? We need to change the narrative. We need to help people get educated. It's really about educating and empowering patients to do what's best for them. And when we talk about recreational or medicinal, cannabis, once it enters into your body, always acts as medicine, right? So when we're talking about recreation or medicinal, there is no judgment, right? Everyone deserves to feel good, but it's really about the use and the misuse of cannabis. Are you using it appropriately? Is it improving your quality of life, or is it not? So it's really important to look at that. And we teach people how to have agency, when they are using the different types of cannabinoids and how they choose to treat their symptoms. And so medical patients learn about the basics of the endocannabinoid system. We teach on CBD, THC, the minor cannabinoids, terpenes, starting points, dosing ranges, and various modes of use, timing, interactions, tracking, expectations. It's not going to work overnight, although I've seen miracles with some patients. And, patients that have less pain, less stress, more joy, more rest, life becomes more manageable. So what we do a lot is we take a harm reduction approach. So when patients are on a lot of pharmaceuticals, CBD may help reduce those pharmaceuticals, especially for pain, anxiety, and sleep. And basically, we can avoid the short-term and long-term consequences of those heavier drugs, such as liver damage, kidney damage, heart issues, brain dysfunction, and GI disturbances. And so cannabinoids don't appear to have any harmful long-term consequences. On the contrary, we see most people enter into the thrive zone. So what we're looking at is we need to look at risks versus benefits, CBD versus prescriptions. What are the side effects? What are the safety? What is the efficacy? And what is the cost? So we literally do some hand holding when we're working with patients to guide them to choose what is best for them. Okay, this is a busy slide, but it's important because literally there are so many different products out on the market, and we're seeing more and more being produced every day. But literally, topicals are a great introduction to cannabis. There's a local application to the affected area, no systemic effect, meaning it cannot get into your bloodstream. And so we see a variety of different topicals, balms, creams, salves on the market that patients can apply. Generally, patients will apply it once or twice a day to that particular area. It's a great start. And then certain patients may want to try transdermal patches. So transdermal actually means that it does get into the bloodstream. And so we've seen a lot of patients that try these and do really well with them. It's for longer duration with ongoing basal dosing. Remember, the endocannabinoid system, we want to microdose to supplement, to mimic what our body is doing. So really, really important, and patches can provide that. Tinctures, right? You can see all these different tinctures here. Tinctures, basic tinctures are made from alcohol, but a lot of the tinctures that we utilize are made from oils. And so they actually extract the cannabinoids, put it into an oil, and there's many different types of formulations. So generally for patients, when we're starting, we like to educate them on using a full spectrum CBD for the daytime to get started, maybe a THC dominant for the nighttime, and adding some of those various cannabinoids in various formulations and ratios to boost what they're doing. Sublingual strips are very, very similar to tinctures, where you put it under your tongue, you let it melt, and it gets absorbed into the sublingual space, and it goes into your bloodstream rapidly. Edibles. Edibles can be really tricky for a lot of patients. And so when patients are starting with them, we like to teach people how to microdose. 2 to 5 milligrams. You can find edibles in sweets, in capsules, in gummies, candies, drinks, and even protein shakes, believe it or not. So depending upon if you're using THC or CBD with your edible, it's really, really important to know what it is, how much it is, because when you take it into your system, it converts into your liver and it can be a lot stronger, particularly THC. And so when we're talking about THC edibles, we always like patients to have CBD on hand. Why? Because we want to soften THC. We want to minimize any uncomfortable feelings and mitigate any potential side effects of overconsumption. And then we have suppositories, which some patients learn, rectal or vaginal. We've seen patients utilize that have had good benefits. And then inhalation. As you can see, inhalation is at the bottom. We are not anti-inhalation. However, oftentimes, a lot of patients may not need that right away. Some patients do, some patients don't, but it's important to work with a clinician to determine what might be best for you. Targeted formulas. This is where it's really gets really interesting and cool. We talked about minor cannabinoids, so targeted formulas that you can actually purchase on the market today. Think of chemo type 3, high CBD. Chemo type 3 is for me. Chemo type 3 has more CBD than THC. It is generally a 20-to-1 ratio. It's whole plant, non-impairing, and is very well tolerated. So Bloom Hemp is one of the, we're profiling them today. They're an amazing company. And so they have a lot of different formulations where you can mix and match and create your own toolkit. Day relief, night relief, pain relief, neuro, focus, immune, anxiety, and sleep. And so really important when you're starting off is you want to wake up your endocannabinoid system, utilize these frequently throughout the day, small doses to mimic what our body is doing. Side effects. I wouldn't be a good nurse if I didn't talk about potential side effects, but I'm going to start off with disclosure is whole plant formulations, micro dosing, taking small doses throughout the day, and working with a cannabis clinician may help decrease side effects. So all of these side effects are dose dependent, and cannabinoids have a biphasic nature. And what I mean by that is low doses of THC may relieve nausea. High doses of THC may make someone throw up. Low doses of THC can manage anxiety. High doses of THC can make someone paranoid. So it's really important. And we generally do not see very many side effects when we're using a total amount of CBD of 100 milligrams or less a day and THC 20 milligrams or less a day for the myth and divided doses. So one of the things when I'm talking about side effects versus the effect is certain patients, the side effect may actually be the effect that they're looking for. For example, the patient that has ALS wants the dry mouth. The patient that has glaucoma welcomes the red eyes because the red eyes demonstrate that the vessels in the eyeball are dilating to allow more oxygen-rich blood, also to decrease the pressure in the eye. Nausea, cachexia, the patients welcome the munchies and the increased appetite. And those patients that have been traumatized, that have issues with hypervigilance, difficulty sleeping, they welcome the drowsiness, the sleepiness, and the forgetfulness. And then the depressed patients, euphoria, excessive smiling, right? We all deserve to feel good. There's nothing wrong with feeling good. And so really important for you all to understand microdosing for the win, and also decrease some of those side effects is to make sure you have a good THC on board. Safety and dosing, right? I'm going to say it again. You want to take the lowest possible dose to get the therapeutic response below the threshold of impairment, right? The Goldilocks dosing, the sweet spot is what we're looking for. Start low and go slow. Microdosing to mimic endocannabinoid signaling. So a lot of times with patients, we'll do breakfast, lunch, dinner, and bedtime, and as needed. We have patients choose their primary formulations, generally CBD-rich formulations in the daytime, THC formulations in the evening and as needed, and sometimes the 1-to-1 ratio. Really, it is about improving functionality to help patients get back to living. Stacking products, right, is more cost effective and keeps the tolerance low. So this is combining a lot of different products. So oftentimes patients will do a topical tincture in a capsule or a topical tincture in a gummy. And the reason why is because these different methods of administration get into the body a different way and do something different. But when you put them all together, think entourage effect. And then a lot of times, people will ask us about safety with other pharmaceuticals. So many drugs, or majority of drugs, are metabolized through our liver, through the CYP450 enzyme. And so any drug that interacts with grapefruit, we like people to be cautious of, and we have people dose 1 hour, 1 to 2 hours after taking their medication. Right? You take your pharmaceutical, you wait, and then you take your cannabinoid, your CBD. because we want to improve the efficacy of the pharmaceutical. So hopefully over time, patients can decrease their doses. The only thing I do recommend with other pharmaceuticals is some of the opioids. We've seen patients that have taken CBD with a particular, Percocet or Oxy, and they're actually able to keep their doses low. The other thing that's really important is to journal and track your results. Really important. Patients will call us up and they'll say, Sherry, this isn't working anymore. And I'm like, what do you mean it's not working? It works. And so generally, when you track and journal, we like people to look at all different things. It's biopsychosocial. Is it improving your sleep? Is it improving your eating? Are you doing all the health and wellness activities that you should be doing to manage? Are you supporting your endocannabinoid dome? 9 times out of 10, patients will be like, oh, I didn't sleep good last night. Oh, I got into a fight with my wife. Oh, yeah, I drank too much last weekend. So you can see, people start to feel good and some of their health and wellness activities can go by the wayside. And so journal and talk to your provider. And oftentimes we, as clinicians, will talk to your provider. Shopping for safe CBD, Green Nurse approved, right? We do have on our website, Green Nurse approved marketplace. We like people to make sure that it is tested. You need to look at accurate labels for potency and serving size. We want to look at purity, potency, contaminants, residual solvents, and accuracy. And if you need help, we have the nurse line that you can call and we can help you to learn about what CBD products might be best for you. And when we're talking about healing, right? Cannabinoid therapeutics is much more than just cannabis. The essence of nursing is human caring for the entire human experience, and everything is interconnected: mind, body, and spirit. Clinical healthcare takeaways before I pass this over to Elizabeth. We are hardwired to respond to cannabis supplements to nurture a weakened endocannabinoid system back to health. As we said, cannabinoids act as a pleiotropic, working on multiple different systems at the same time. Chronic illness is costly and poorly managed, and patients need our help. Cannabis is safe. No one has ever died. And there are so many different flexible options that patients can utilize. And it shifts healthcare from sick care to pursuing health and well-being. And so CBD and cannabis may help save millions of lives and millions of dollars.
Billions.
Back to you.
Thank you. So yeah, that was a great recap of CBD and how this works as a pleiotropic powerhouse in our body, mind, spirit, social, all of this, right? And cannabinoids have such a great option for so many people, and they're natural, right? So let's talk about some of the dollars and cents and how much these might cost. We talked about the tinctures, edibles, vapes, and salves and topicals. And these are all of the different routes of administration that have different pharmacokinetics, different plays. And we talked about stacking them and how do you put that together so you can use short acting and long acting, right? So inhalation for that immediacy when we need a pain reduction, and then the capsules, the tinctures, the edibles for long-term dosing. So when we put them together, I always tell patients a budget about $150 a month to start. We can get you good on some good CBD formulations, fold in THC as needed, and put together a treatment plan that works for you. So this is an exciting thing. Many people don't know that CBD is an actual pharmaceutical, because it really is. This is Epidiolex. Epidiolex was approved in 2018 for Dravet syndrome, those refractory seizure conditions where some of those poor kids are having 300 seizures a day. CBD is able to almost eliminate that and give these people back the quality of their life. Unfortunately, it's expensive. It's about $3,000 a month. And many families can't afford that. So when we think about the compare and contrast of pharmaceutical versus going to a dispensary in some of the online hemp markets where we can get very good quality CBD, full spectrum CBD, we can compare and contrast that with Epidiolex and see if we can do something for a little more cost-effective option. Sometimes when people ask me about the costs of cannabis, we're like, is it going to cost me more or less than my pharmaceuticals? Sometimes when people are on very inexpensive treatment plans, it can cost a little bit more. Sometimes it's a little bit less. But we really do need to do that dollars and cents, and then really quality of life and symptom reduction. Are those pharmaceuticals really working for you? And are you getting value for what you're spending? And is there a better way? And how do we do that? So as I mentioned, I spent 20 years in insurance plans, and I do have a dream that one day we're going to go back and we're going to build in the actuarial tables coverage for patients to be able to get this, because we know that access, we got 70% of Americans now with access to medical cannabis products, but affordability is a big issue. Some of them can't spend this extra out of pocket. And if we have insurance reimbursements, we can make this more affordable for more people. And the good thing is, once people do take this path, they see that they can reduce some of their pharmaceuticals. Some of the first ones, ADD, autism, migraines, nausea, vomiting, bipolar, fatigue, and pain. Pain is the number one condition where people are eliminating pharmaceuticals, NSAIDs, getting out of all the trouble with the hypertension, stomach bleeding, those sorts of things. I know I took myself from 2,400 milligrams of Motrin a day to about 200 every couple of days. So that's a huge difference for my body, for my wallet, and we want to help other people do the same. And we can save money. So we talk about saving millions of lives and billions of dollars. Medicare and Medicaid across the board, every time we have a new medical cannabis state come online, they're saving money. And we're getting better value for our dollars, right? And again, we have a voice on how we want to spend our money, how we want to treat our health, and how we can go to that biopsychosocial, spiritual health care where we're not just managing a disease and that sort of thing. So what we do at Holistic Caring Green Nurse is to take people from the pharmaceuticals to the cannabinoids. And this is something very exciting that I want to work on with Dr. Phil to really take people into this on a systems level and start to make a therapeutic change. But it's going to take a village. So with that, we'd like to tee up some of our programs. We have online app-based programs where we can train healthcare professionals to become a cannabis health coach, where they learn all of the therapeutic modalities of these plant compounds and how to put that into clinical care, as well as the cannabis industry professionals and helping people get new jobs. And then on the patient side, we have all of these beautiful paths of wellness for cancer, mental health, autism. And what we do in these programs is we break it down. So we give you about a 60-minute recorded lecture about that condition. So teaching you about cancer. How does a conventional care treat cancer? What are the shortfalls and limitations of those side effects? And how can we bridge the gap with cannabinoids, bringing people more natural options that's going to reduce symptoms, improve quality of life. We give you the guidebooks, the references, so that you can study what we studied, take these to your doctor, have those conversations, and let us know how we can help you live a better life. And we can't do this on our own, so we need to share it, right? We need a sales team. So if you are inspired by what we've shared today, go to our website and let us know that you'd like to work with us. We're changing our affiliate system right now, so we're going to have a new one next week. But the point is, join our newsletter, stay in touch with us, and help us share this because we do have incentives for you. And it's never too late. The Bredesen protocol is proving the point. This beautiful physician, Del Bredesen, is taking people that are early Alzheimer's and reversing that with metabolic approaches, diet, cognition studies, etc. And we want to add CBD. Imagine if we can take CBD into older adults and assisted living facilities, etc., and giving all kinds of people a better day and way of life. So an invitation to brokers and health plans. I like to close with this because people don't know that 1 out of 4 adults in America is struggling with chronic pain. And a lot of those are already stuck on some form of pain medications and opiates. 100,000 people died last year of drug overdoses. That's 272 a day, 11 per hour, just in when we were sitting here talking. That's 100,000 too many in my book. We can introduce CBD to the self-funded employer groups, do a demonstration project to save dollars and improve care. Disease management programs. Let's manage those high-cost members together. Share it with senior clients. Seniors have the most to gain, and they need less pharmaceuticals to give them better quality of life and less delirium and side effects from those drugs. And then the 40-plus clients, think about those seniors' kids that are just starting to get medicines for cholesterol and blood pressure and blood sugar. Don't do it. Talk to us. Let's get you some healthy lifestyle living feeling and fold in. Let's escape the healthcare matrix of conventional care and try CBD yourself. Learn how this works. Become an evangelist with us and help us spread the news, because we can change the paradigm of healthcare. And why don't you wrap us up on the network? It's so amazing how you talk about the website.
Yeah, I love it. I love our website. So if you go to holisticcaring.com and you pop it open, you're going to see the Green Nurses at Holistic Caring, Cannabis Medicine Simplified. So we have the shop and we have the network. We invite you into the network. It is free for patients and providers. It's run by nurses and our pharmacist, Charmaine. We love you, Charmaine. And within the network, we have a free introductory to cannabis course, webinars, webcasts, podcasts, support. And this is where we're doing our clinical training for nurses, because we are creating jobs for nurses, and we're very, very excited about that. The other thing we have, if you go to the website, there'll be a little pop-up that says sign up for our newsletter. You will get a 7-page free medical cannabis guide that Elizabeth and I have created. It's absolutely amazing.
Beautiful infographics.
Yeah, really good. And then the shop, like we had said, this is where you can get the patient and professional online educational programs. We do mentoring for clinicians, doctors, nurses, allied health professionals. And this is also where we do consultations for patients. So we have a new division called Senior Care and Pediatric Care, and we have packages that are available so we can actually do ongoing continuity of care, following patients through, providing that hand holding and that guidance that they need to make choices that are best for them. Really, really excited
From
about
pediatrics to geriatrics, everybody needs a nurse, and we want to make this affordable and a package that people can really take into their lives and improve their health and well-being with. So we hope that this has been, inspiring and informational for you. And please help us change that paradigm of healthcare and make this really approachable for all people.
And remember, everyone, what it's all about. It is truly about living your best life and helping others do the same. See you next time. Oh, you can't hear it. All right. The sound is off.
We're here to
Okay. Remember, everyone, it's about living your best
Sorry
life
about that.
and helping others do the same.
All right.
Take
God
care.
bless.
Bye.